I would now like to introduce the Secretary of the QNMU, Sarah Beaman, to address conference.
Good morning, delegates, councillors and members. Welcome to the QNMU's 2025 annual conference. I would like to begin by acknowledging the traditional owners here in Meanjin, where we come to you from today as the Yugara and the Turrbal people. I will also acknowledge the many lands and language groups from which you all come to us today from around Queensland. I would like to pay my collective respects to elders past and present and extend that respect to First Nations people joining us today for conference. I also want to let you know that we will have a chat function where you can throw me some questions. What the team will do is that they will take some of these questions and put them in a document so that I can see them. And time depending, I will aim to answer some of your questions at the end of my presentation. But firstly, I would actually like to acknowledge all of you for attending conference today and making the time to attend. I know it's busy and we know that you are doing some incredible work out there, so I do appreciate the dedication of you for attending the conference. The conference is critically important. We are the largest union in Queensland and collectively our voices cannot be ignored. I say collectively because when we act together, we are powerful. When we act together, we can and do make a difference. I know you've heard all this before because I know I said it last year and I will say it again. It is vitally important that we begin our shared work with reflection. We have come together to work in union. We are here to work together. There is one thing though that I am very certain of, and that's that we are not short on opinions or perspectives within the QNMU, whether that be as a member, an activist, a delegate or an official. It is an interesting place, but it is a good place because differing opinions backed by fact when handled constructively lead to robust discussions and better outcomes as we challenge assumptions and we develop a deeper understanding. We will disagree at times, but in working together in a way that assumes the best of one another and starts with the assumption that we have all come to make a positive difference for our colleagues and our professions, we will achieve positive outcomes together. Many of you are here as elected delegates, and I have no doubt that you will bring your lived experience and factual perspectives of your colleagues that you represent, and I have no doubt that you will make them proud. You are leaders representing the needs and interests of over 75,000 financial QNMU members, and I am delighted to count myself as one of you. On the subject of elections and leadership, there have been 3 important elections since I addressed you last, all of which have implications for our work. So it's appropriate that I address them here. The QNMU council elections took place between February and May of this year, and this was independently overseen by the Australian Electoral Commission, and this ensured a fair and transparent process. This year, as Simon alluded to, we expanded QNMU Council to better reflect our diverse membership, including creating a standalone Assistant Secretary Midwifery position, of which I am proud to see that Friday King is doing, and Friday has been a valuable addition to our team. Grant and I are thoroughly enjoying working with her. We've also introduced 2 new Aboriginal and Torres Strait Islander branch council positions to strengthen our First Nations membership and also bring those perspectives to the union leadership. The QNMU Council, elected by the members, and I am actually going to read these in alphabetical order by first name, are Dallas Robinson, Damien Lawson, David Lewis, Emma Murphy, Fawzia Mosby, Fiona Henderson, Genevieve Phillips, Janelle Taylor, Jason Maloney, Jennifer Wilson, Joe Connings, Jojo Tezeram, Julia Brownlee, Karen Cook, Kelly Dwyer, Kim Cass, Lillian Machiri, Megan Briffer, Michelle McInnes, Natasha Eggleston, Raquel Howe, Samantha Woodhouse, Suri Hobday and Jana Clausen. Congratulations to each of you. The full names and the branch details are available on page 6 of your conference booklet. Now, the photo that you see on the screen, we did take at the first council meeting. Friday, we were missing Friday in the photo, but we purposely created a space and we have photoshopped her in. So we're very proud of our efforts there, but I also know that part of our union leadership involves having a branch executive councillors. So that is stage 2 of the elections. So the election of the actual councillors is stage 1, and the election process, as I said, was undertaken by the AEC, and that process was declared on the 9th of May 2025. Stage 2 of the election process was for the branch executive members, of which there are 4 available positions. And elected councillors may actually nominate for this collegiate election undertaken as part of Stage 2. The AEC declared the results of the contested elections for Stage 2 last Friday, and the branch executive members are David Lewis, Emma Murphy, Janelle Taylor and Karen Cook. I extend my congratulations to all councillors and all branch executive. Stage 1 of the elections also elected the executive of the QNMU. Now, Simon has introduced us all, but I am just going to also, for the purposes of clarity, outline that the QNMU executive elected by members through Stage 1 of the election process are Simon Mitchell as President, Lucinda Meskel as Vice President, myself as Secretary, Assistant Secretary Nursing as Grant Burton, and Assistant Secretary Midwifery Friday King. Now, the role of the QNMU executive is to implement the determinations of Council. Our President Simon and Vice President Lucy chair all meetings of Annual Conference, Council and Executive. These are honorary roles responsible for ensuring that meetings are conducted with propriety and in accordance with the QNMU rules. This is a significant commitment from both Simon and Lucinda, and Simon has taken over from Sally Ann Jones, who remains President of the ANMF. Lucinda has held the Vice President position for more than 8 years, and I am very grateful for their contributions. As Secretary, I am the Principal Officer and Chief Administration Officer of the QNMU. I am responsible for managing the day-to-day affairs of the QNMU, and my role operates in compliance with the QNMU rules and values and is tasked with defending action on behalf of the QNMU. Our Assistant Secretaries, Grant and Friday, operationalise our organisational strategy, and they oversee the daily operations to grow the strength, influence, confidence and power of nurses and midwives. We also had a federal election, and I think what's really important, and many of you may know this already, but the federal government holds the power in the aged care and the private space around the federal award, the Federal Nurses Award, the Federal Aged Care Award, and pretty much covers aged care, diverse and private employers with regards to legislation. Now, it's really important that we hold these governments to account because we are a political union. We are not affiliated with Labor. However, our power in the political sphere is phenomenal. For the QNMU, 1 in every 47 eligible voters in Queensland is a QNMU member. Australia-wide, it's about 1 in every 55 eligible voters in Australia is an ANMF member. There is huge power to affect and influence change. So over the last term of government, we were able to influence change. We were able to get Labor to introduce important reforms, including improved wages, 24/7 RN staffing in aged care, improvement to workers' rights, the removal of outdated barriers to practice for nurse practitioners and endorsed midwives, fee-free TAFE for over 100,000 students, and the establishment of the National Nursing and Midwifery Health Program. With the Albanese Labor government's victory in the last federal election, we have firm commitments at a federal level to strengthen Medicare, to make medicines cheaper and to cut student debt by 20%. The ANMF continues to prioritise aged care, industrial relations, workforce, healthcare equity, gender equity, as well as climate change and social justice. We have also had a state election since I last spoke to you. In October 2024, the LNP government was elected to state parliament, and this year they set a health budget of $33.1 billion, which has been allocated to address the challenges posed by Queensland's growing population and the increasing service demand. The government has committed to investing more than $18 billion in health infrastructure over the next 5 financial years, and they will increase bed numbers by about 2,600 across Queensland as part of their hospital rescue plan. This will see 3 new hospitals and a Queensland Cancer Centre and 10 major hospital expansions. And while this funding is actually welcome, we are incredibly disappointed that the government has not yet delivered on its pre-election commitment to maintain nation-leading wages and conditions for nurses and midwives in Queensland Health. If they do not achieve this, this will greatly impact the Queensland Government's ability to retain and recruit skilled nurses and midwives to Queensland. Coming into the election, it was absolutely unambiguous, their commitment to this. It has been incredibly frustrating for us that they have put forward 2 offers that have fallen short of these nation-leading wages and conditions. and we continue to work with the government on trying to secure an agreement that actually achieves nation-leading wages and conditions. Also coming into the state election, the QNMU raised concerns around the LNP with regards to contracting out of health services. Contracting out is privatisation by stealth. The introduction of 2,600 additional beds, but without nation-leading wages and conditions, not having the staff to fill those. We have 300 unfilled shifts every day in Queensland Health already. We remain deeply concerned that with so much capital investment and inadequate investment in the workforce, that contracting out and privatisation by stealth remains on the cards. As I said, maintaining nation-leading wages and conditions for nurses and midwives, that commitment was clear and unambiguous. At the moment, the government has not put forward an offer that covers. We have 66% of nurses and midwives at the last offer put forward that would be not nation-leading. Now that brings me to bargaining. And this is a proud story for me, and Simon alluded to it too. There were many of us that were working during the 2002 dispute. So a generation ago, public sector nurses and midwives, including my mother, and many of you heard about her last year in my talk, but many people, including my mother, stood up and took protected industrial action to push our professions forward. It wasn't easy, but it mattered. Back then, Queensland nurses and midwives were some of the lowest paid in the country, and they changed that by standing stronger together. I have been watching with pride as tens of thousands of you carry that same spirit and continue the fight across Queensland. You are fighting in metro hospitals, in regional hospitals, and in workplaces as remote from Torres Strait right down to the Tweed and out past Toowoomba. You've stepped up. You've taken action to fight for what we all know is right, and that's to recruit and retain and respect nurses and midwives. You are continuing a proud tradition of collective strength and courage. You are showing the government what real power looks like. And we aren't just seeing that strength in Queensland Health, we are seeing it in aged care and private sector too. It fills me with immense pride to be now leading our union at a time when tens of thousands of QNMU members are taking action to improve their working lives. This time though, members are taking action across every single sector. In Queensland Health, we started this journey for a fair EB12 agreement more than 6 months ago. Queensland Health members are taking protected industrial action for the first time since 2002. You are taking action because you deserve better. Better than government delays, better than their threats and legal tactics aimed at silencing your voice and devaluing your work. It has been a long road and we don't yet have a deal, but I want you to know that what you're doing is working. We are seeing real movement at the negotiating table, and that's only happening because of you. Every single member participating in action is making a difference. From painting workplaces pink to participating in work bans, you are showing just how much nurses and midwives carry our health system. Your action is putting pressure on Queensland Health and it is shifting things at the bargaining table. I promise you, they know how powerful you are, and they are absolutely feeling it. Now, while I am prevented from sharing progress during conciliation in the QIRC, I can say with certainty, your actions you're taking right now remain critical to ensuring that Queensland can recruit, retain and respect the nursing and midwifery workforce the health system needs now and into the future. As someone who has been a union member and a union official for a very long time, I know for a fact employers will only try to make it hard for members to act together when they know it's working. And we know it's working because we are hearing it's hitting Queensland Health where it hurts. I know taking protected industrial action is a big step. It takes guts, it takes unity. It takes the belief that what you do matters, and I can tell you it does. This is a big fight, but it is the right fight. For better pay, for safe working conditions, and for safe workloads. For a system that values and respects you and your work. And I believe in each and every one of you. Keep going, keep standing together. Together we will win. I can also say the same for our members in private sector. Last year, we secured 18 enterprise agreements across private hospitals, aged care and the diverse sector. But of course, the work of the union is never done. This year, we have 14 employers, as many as 14 employers in the private sector commencing enterprise bargaining. This includes Marta, Icon, Ramsay, Uniting Care Health, Wesley Mission Queensland, Genesis Cancer Care, Queensland Fertility Group, Monash IVF, Koana, this one's a hard one, Fresenius Medical Care, Ipswich Hospice Care and Aurora. We have already secured 3 private hospital agreements, 12 aged care agreements and 3 diverse sector agreements. Already, members in Queensland Fertility Group have rejected inadequate offers and they are taking action, and our members at MARTA have rejected a 2.5% pay increase. It is also important to note that over 95% of private nurses covered by an operating enterprise agreement have pay rates at parity or better than their public sector, and this was achieved by members taking action. While the outcomes of the current negotiations within private sector agreements are not yet known, what is clear is that it is the action of members that will make a difference. It will make all the difference. In aged care, we had the ANMF work value case to which the QNMU contributed significantly, and this case was brought about by members of the QNMU and the broader ANMF. The outcome of this ensured that all direct care workers, including RNs, ENs and carers, received increases to their wages. In March, we obtained a commitment from the federal government that funding would be provided to aged care employers to ensure aged care nursing staff received a wage increase of the same dollar amount that the award increased by. In addition, our branch, the QNMU, is pursuing a landmark application for supported bargaining authorisation, which would allow us to undertake multi-enterprise employer bargaining with multiple aged care facilities. This is the first application in the country, and it is for a multi-enterprise supported bargaining. Now, this is a move that in aged care could reshape how wages and conditions are negotiated across all sectors. We know that aged care employers and unions across the country are keeping a close eye on its progress. We are in the Fair Work Commission later this year, and we are looking to undertake multi-employer bargaining with Anglicare, Superior Care and Catholic Healthcare soon after. The QNMU strategic plan, it's critically important because not only do we have 79,000 members all up across private, public, aged care and diverse sectors, we also have a business to run. And we are halfway through this QNMU strategic plan, and there is a raft of work happening across our goals of secure work, safe work and respected work. Now, when I talk around the organisational targets, as I said, some of our work focuses internally, but the work that we do internally enables us to help members externally. And I am pleased to say that we are already delivering on our organisational targets. For example, in safe work, we have been strongly advocating for workforce policy reform for some time, and our work in this space resulted in the Health Workforce Strategy for Queensland to 2032. This was established by the former Labor government but has been adopted by the LNP government. Our position remains clear that without programs to recruit, retain and respect our nursing and midwifery workforce, the government will struggle to meet the needs of Queenslanders, which is why so many of our workforce policy recommendations have been included in our EB12 asks. In secure work, we have sought a raft of enterprise agreement level improvements to wages and conditions across all sectors, and we will continue to advance this as a core part of our work. In respected work, we have seen record levels of member recruitment, retention and engagement. For example, the QNMU continues to grow, reaching 75,743 financial members at the end of the financial year. So let's take a brief look at how we've been tracking over the past year. I keep talking about member numbers, and there is different numbers I refer to. Some of that is financial member numbers and some of that is total member numbers. We have just ticked over 79,000 members, of which 75,743 are financial. That is a total growth of 6.1% over the financial year. Of that, of the financial members, that is a growth of 5.7%. Excluding students who are fee-free paying, the growth still sits at a healthy 4.7%. This is phenomenal. At a time when union membership is declining in other areas, we not only grow, we are growing at a rate of knots. They are impressive numbers in any climate, and they speak to the strength and the relevance of our union across the sectors. Now, public sector members do make up the largest proportion of our membership, covering about 62% of our members. But we also do have growing strength across our private, diverse and aged care sectors. The remaining 38% of our membership is actually split pretty evenly across that 38% with equivalent proportions across aged care, private and diverse. Now, when I talk about diverse sector, for those of you online, that's your GP clinics. That's anywhere that's not a private hospital, an aged care facility or a public hospital. So But what's also important is that we're also growing across all classifications, with registered nurses, enrolled nurses, assistants in nursing, midwives and students all represented. Among our key recruitment and retention strategies is education and engagement, and our efforts remain strong. QNMU representatives have attended 225 orientations and open days across Queensland. They have delivered 113 courses and engaged more than 1,300 members in professional development. We also continue to deliver concrete wins for members. We have recovered over $3.16 million for members in the last financial year. We've supported members through 1,813 servicing matters, 294 legal matters, 219 regulatory matters and 486 wellbeing cases. Now, for anyone who's ever had to use our servicing area, we know that they do an incredible job. We know that this is sometimes the hardest thing that members will ever face is disciplinary action or allegations. Our team are experts, they are nurses, they are industrial officers. Their expertise has helped many members through what is a difficult time, and our wellbeing team continues to support those members through this change. In terms of wages and conditions, it has been an incredibly busy year. We are, of course, engaged in current EB12 negotiations and also in negotiations with major other employers such as MARTA. In relation to EB12, a record-breaking 96% of members who voted to take protected industrial action, and over 10,000 members signed the PIA pledge cards. More than 12,000 told us that they backed our state election campaign, calling for better investment in public sector nurse and midwife workforce planning. We have a huge public presence, and this is important because in all the campaigns we do, the community support does make a difference. We have kept a strong and consistent public voice over the last year with over 317,000 media mentions and an estimated reach of over 655 million views across unpaid media. Now, this unpaid media carries an estimated value of over $6 million. Our digital presence continues to grow with social media and website engagement reflecting strong member and community interest. Beyond the headlines though, our research and policy work remains central to what we do and gives voice to our values. We've drafted over 66 QNMU submissions. We've contributed to a further 46 submissions through the ANMF, QCU and ACTU. We've reviewed 25 internal policies to ensure they remain evidence-based and member-focused. And the QPC has developed 6 new position statements, a discussion paper and a research report, all shaped by the professions. We've also appeared at 3 public hearings. This is how we shape policy, this is how we speak up, and this is how we stand strong for the professions. So whilst last year was incredibly busy, we do remain busy with bargaining across all 3 sectors, and make no mistake, we are firing on all cylinders. In workplaces across the state, QNMU members are actively leaning in. They are helping to make a difference for themselves, their colleagues, their patients and their residents that they care for. As I take stock of the activity currently being undertaken by QNMU, I am reminded that our achievements are not the result of individual action, they are the result of our collective strength. It is remarkable what is possible when members come together to speak up, get involved and support one another, but members must be prepared to take action to find that strength. Now, I'm not talking about grand gestures, I'm talking about simple acts that demonstrate that you want a better deal for your workplace. This could be a conversation between colleagues, it could be attending a branch meeting, it could be taking time to read and share information that the QNMU sends out about bargaining and more broadly. Now, these seemingly small steps build connection, they build confidence and they build capability, and this is the foundation for a strong and active union, and each of us has a role to play. Whether you're encouraging a new graduate to join or mentoring a colleague or taking part in a campaign, your contribution matters. Our power as a union and as nurses and midwives it really does lie in our ability to act collectively. We are Queensland's largest union, and when we act together, we are impossible to ignore. While we will not always agree on every detail, we can assume the best of one another and take small actions to advance the professional and industrial interests of nurses, midwives and carers. Acting together, we will make a difference. And while I'm proud of the hard work and dedication and professionalism of QNMU staff, I remain absolutely clear-eyed, and so should you. The success or failure of our industrial campaigns will hinge largely on the willingness of QNMU members to act together in union. That is a message I need all of you to take to your branches. You are part of that work. In fact, as delegates and alternate delegates, you are instrumental in enabling our democratic processes. You are the vital link between the members and the operations of the QNMU. Now, if you don't know, and you should, alternate delegates and delegates are elected for a 2-year term, and nominations will open on Friday the 22nd of August 2025 for the next term. I want to take this opportunity to thank each and every delegate and alternate delegate for putting your hand up and representing your local branches. I want to thank you for making sure that your colleagues' voices have been heard. Now, during the next 2 days of conference, it remains your job to help chart the direction and the priorities of our union, to raise important issues and to advocate for meaningful change. I look forward to working with you and ensuring that our union continues to make a difference for members, our professions and the community. Now, it is a bit of a thank you slide, but I do have a couple of things I want to add. In our first conference meeting, we had a motion put forward to confer life membership upon 2 outstanding activists and leaders. It gives me great pride to announce that Kim Volp and Sally Ann Jones have been conferred life membership of the QNMU. We will hold a formal presentation of that in due course, but it gives me great pride to share that today. It also gives me great pride to let you know that we have some amazing presenters coming forward. Now, the Health Minister will be talking next. I want you to extend to him the respect that comes with being in such a position. These are difficult jobs, and I know that you will do us proud in this space and listen to him. We also have Will Strachey later this afternoon. Now, Will Strachey, if you do not know who Will Strachey is, I want you to Google her. She is phenomenal. She is vibrant. She is engaged. She is a unionist. And I'm so proud to have her speak at conference. And tomorrow we will have Mark Bailey. Again, I want to say a big thank you to everyone for turning up today. Your work does make a difference. It gives me the ability to advocate strongly for all of you seeing such engagement. Thank you. And the team is telling me that no questions have come through, so well done.